Medical workers of Reddit. What were the most haunting last words you've heard from a patient? 1. My dad came by my house and just poured the love I needed to hear my entire life. We hugged and I'll never forget him telling me how proud he was of me. This was very out of character, but it was validation for me. He died 5 days later from a massive heart attack in my arms. 2. My dad was in the hospital, dying, and before I went inside to clock in at work, I called him. We didn't have a good relationship, but I told him that I was just calling to tell him that I loved him. I was about to hang up when he said, "Wait. Talk to me a minute." I did. He asked how I was doing, how my car was running, if my tires were aired up. He asked about his dogs at home and I reassured him that I had been taking very good care of them. He said he was feeling terrible, and I told him not to worry about getting out of the hospital, or about coming home, or getting better, because it was all about to be over, and all he needed to do now was rest. I told him I loved him. He said he loved me. He died 2 days later. I'll never forget him saying that. Talk to me a minute. I'm so sorry for your loss. 3. My dad was in the hospital, dying, and before I went inside to clock in at work, I called him. We didn't have a good relationship, but I told him that I was just calling to tell him that I loved him. I was about to hang up when he said, "Wait. Talk to me a minute." I did. He asked how I was doing, how my car was running, if my tires were aired up. He asked about his dogs at home and I reassured him that I had been taking very good care of them. He said he was feeling terrible, and I told him not to worry about getting out of the hospital, or about coming home, or getting better, because it was all about to be over, and all he needed to do now was rest. I told him I loved him. He said he loved me. He died 2 days later. I'll never forget him saying that. Talk to me a minute. I'm so sorry for your loss. 4. I am a medical worker, but the one that stays with me is actually when my aunt was dying. I think I was about 14, and she was my favorite aunt. I held her hand and asked her to wait until her birthday so that I could wish her happy birthday, a silly request looking back, and the last thing she said to me was, "Okay." She lasted until the morning of her birthday. I wished her happy birthday, and she passed away with a smile. I had forgotten that until I saw this question. Thank you for asking it. 5. I spoke on the phone with my dying grandpa and told him I would be coming home for him. He said that he would be waiting. I was living in a whole other country and I was in the hospital myself, so there was no way I could have gone. He waited and suffered, but he refused to let go. After days of agony and pending death, my sister enters his room and he instantly asks if that was me. My uncle replied, "Yes, that's her," and that was it. He gave his final breath. 6. What a sweet thing to do. So many people feel obligated to be truthful when sometimes a lie is the most compassionate option. 7. What medication is applied through the ear? Words of comfort. 8. And eardrops. But mostly that first thing. 9. During COVID I was stuck in the States and my great-grandmother was in Europe. I called her every week and she always said, "Come home, I want to see you so I can finally die." I was able to visit in 2021 and spent lots of days with her. When I left, she told me it'd be our last time together and she's ready to go. She passed 2 months later. 10. That is not a silly request. It's the request of someone who really loves their aunt. 11. 84-year-old woman with advanced dementia. She was very combative at night, scratching, biting, pulling out her the fourth in oxygen. I was her nurse for a week or so before she died. One of the last nights, the clouds parted, and she had a moment of clarity. She looked up at me from her bed and said, "This is hell. I am in hell right now." 12. This is why human euthanasia-assisted suicide should be legal everywhere. When a person's quality of life is bad enough, terminal, and they consent, it's the most humane option. The kindest option. We do it for our pets but not our parents. Mayo. I watched my grandmother lose herself to Alzheimer's. She suffered with it for 16 years before she finally died, unable to recognize her own husband, 8 children, or grandchildren for nearly a decade at that point. She was locked away in a care facility, confused and probably terrified, even if she didn't understand why. Everyone who loved her suffered every day as we watched her decline, my grandfather most of all. Once she passed, he gave up the ghost despite being fit and healthy for his age. The process of watching his wife die like that fucking destroyed him. Your patient was right, it is hell. If I ever get diagnosed with any form of dementia and there haven't been significant strides in how we treat it, I'll probably focus some time on getting my affairs in order and take myself out to spare my family the miserable, drawn-out process of losing me to it. Wouldn't wish it on anyone. 13. With you on this. Seeing firsthand multiple times what different forms of dementia will do to someone, I will not go through that. I especially don't want to put my loved ones through that. Affairs in order the best I can, and lights out, in a way that will require minimal cleanup. 14. I want to agree with you. I don't understand how we could calmly put our sick and dying dog down a week before my father passed. But couldn't help my dad in the same calm way. He was suffering from dementia. He was well enough to be assisted 24 hours a day by my mom for many years. It got worse and worse, but she kept caring for him. The last year was horrific and he was too aggressive to place in a memory care unit, but not physically unwell enough to place in nursing care. We couldn't find help or anywhere in the state to take him even if we paid cash. The last month was even worse. We finally got the police and EMTs to get him to a hospital. The hospital sent him to a rehab where he ultimately passed away. I don't know where in that crude timeline he would have 1. Been capable of saying he wanted assisted suicide and 2. Been sick enough for it. When he could have agreed to it, he still had some time left where he just needed assistance. By the time he needed it, well, he wouldn't be capable of agreeing. So, I want to agree with you, but I don't know how it would work. 15. That's been the issue here in Canada, where medically assisted death is legal for physical illnesses. There's no clear threshold to say, when my dementia reaches this point, and things no matter what I say or do at the time. Most people don't want to end things as soon as they get the diagnosis, but by the time things are bad they can't give consent. I hope by the time I'm at risk for dementia there's some sort of blood test or imaging that can be used as a threshold for those sorts of directives, something like, if imaging shows X number of plaques in my brain, proceed with the plan. 16. This story only barely fits the criteria, but did he take my purse? I worked LN in a low-income area. We had a woman come in with no prenatal care. I don't think she gave us her real name. She was 42 years old and covered in awful scars, like she'd been in a knife fight and stitched up by Dr. Frankenstein? She and her boyfriend appeared to be actively using substances, and both acted high at the time. She was in hard labor. About 15 minutes after arrival, far too soon to do anything, she delivered her baby. It was maybe 16 or 17 weeks, nowhere near the age of viability. We carefully wrapped the baby, who was somehow still alive, and asked the dad if he wanted to see her. This is common practice in LN. Letting the parents see, touch, and hold their dead dying child helps them grieve. He said yes. We gently unwrapped her, and he freaked out. I don't know if he was so high that he didn't understand what we were asking or what, but he grabbed the large, cheap black purse and booked it out of the hospital. The mother immediately looked around and said, "Where's my bag? It has my medicines. I need it." We tried to help her understand that we would give her anything she needed, that she might bleed to death if she wasn't monitored, etc. But it didn't penetrate. She left Emma 16 minutes after the birth. That left me with her baby, whose heart was still beating and who was still taking tiny, gasping breaths. The neonatologist and the nurses talked about it. We all knew resuscitation was pointless, and she wasn't going to live. I asked my coworkers if they were okay with me stepping away from patient care for a while. It wasn't terribly busy, so they were fine with it. I went to our lactation room, got a blanket and some Vaseline, and did skin to skin with that baby until she passed, 45 minutes later. I hope it was some comfort to her. The mom never came back to claim her body. The whole situation haunts me to this day. Edit. There are so many comments that I can't reply to them all individually, but I want to thank you all for your compassionate comments. They are appreciated. 17. You are an angel. Thank you for loving that baby. 18. You are an angel. Thank you for loving that baby. 19. What a lovely comment to the amazing nurse who posted her story. This world needs more people like you too. 20. You just made me cry. What a lovely way of looking at it. 21. As a former midwife, I salute you. You are a credit to the profession, and deserve all honor for your most caring gesture. Utterly heartbreaking, but, truly, a most wonderful thing to have done. I know the frustration and pain that we cannot save these premature babies, and have shed tears over them, and your story made me weep. You are the kind of nurse I would want to care for my family. Thank you. I wish only good things for you. 22. This is the most touching, beautiful, hard to absorb comment in the entire thread. To have the humanity and capacity to lay a tiny premature baby, likely not even fully formed, on your own skin, to give them comfort and peace like their mother would if she'd been able. You are an incredible person. And you did a beautiful thing not just for that little baby, but for their mother and father too. They weren't able or willing to be the parents that baby needed and deserved, and you stepped up. I imagine if they're still around and ever found out about what you did, they'd thank you for it. I appreciate how you didn't express any judgment or condemnation to the parents here too. 23. This one breaks my heart. Thank you for being there, and being a safe, warm place for that baby girl as she left this world for the next. 24. Thank you for caring for that baby. I have the urge now to drive across town and hug my own baby, a 16-year-old at a sleepover with friends. 25. This destroyed me. Thank you for your tenderness towards that poor sweet baby. 26. You're a wonderful person. My baby was stillborn at 21 weeks, and even though he was already gone, the nurses treated him with such love and gentleness. The world is a better place with people like you in it. Thank you, and thank you for sharing this baby's story. 27. In my grandma's last days we went to visit her. She had exactly one lucid day, and she asked, "Is everybody here to see me?" I said yes, and she said, "Why? Am I dying?" I held back tears and told her, "We just love you very much." Even typing it now I'm crying. 28. My grandma has dementia and hasn't had a lucid day in a while, but while visiting she looked at me shocked and said, "Quiet lady." And I said, "Yeah grandma, it's me." Completely shocked as well, because if she called me anything it was my mother's name. Then she said, "I love you." I rushed to say it back. "I love you too grandma." She looked me up and down completely disgusted. "Who the fuck are you?" The whole room just sat there blinking for a few seconds before we burst out laughing. 29. Oh man, I would have died laughing too. Probably followed by some tears. 30. The last phone call I had with my ailing grandmother was terrible in many ways. The thing that got me the most was her saying, "This is no way to live. This isn't a life." She was referring to the fact she's been on dialysis for a while and had gotten to the point of being bedridden. She decided to get taken off of dialysis and just go into end-of-life care because her quality of life was so low. My grandmother was one of the strongest, kindest women I have ever known, and for her to make this decision showed me what it was to let go. My grandfather had died maybe a year prior, and I know she was ready to see him somewhere out there sooner rather than later. I miss her terribly around this time every year. 31. Oof. This one really got me. My grandma was my favorite person in the whole world. Man, I miss her so much. 32. My grandma raised me and 4 of my siblings while my mom kept running around getting pregnant back to back. I have a ton of childhood trauma, but I guarantee the only reason I'm halfway normal now is because of the love from my grandma. I miss her so much. I'm thankful she passed when she did, though. It was about a month before COVID lockdowns started happening, and if it had been any longer we wouldn't have been able to say goodbye. She had also already been suffering for several years, and it was a relief for her more than anything. 32. My grandma raised me also, and she saved my life in ways I'm still discovering at 40 years old. I miss her every day. She couldn't shield me from my parental trauma, and she wasn't a perfect person, but she gave me space to be a kid when I couldn't really do that anywhere else. As you say, she's the only reason I'm even halfway normal now. I'm glad you had someone for you also. 33. My grandmother fell, and my grandfather couldn't get her up again and had to get a neighbor to help. He called my mom and said that it had reached the point for both their safety that he was going to have to put her in a nursing home. She had progressing dementia but was mostly lucid. Her physical health was declining too, and they were both in their early 80s. She heard my grandfather say this and said that she wasn't going. She was going to die in her own home. That was just after lunchtime. We were sitting having dinner at my parents' house when my grandfather called again. She'd sat down in her recliner for a nap, as she did many afternoons, and when he went to check on her she'd already died. She told him she'd die in her own home, and she did exactly that only about 2 hours after the conversation. My grandmother was one of the most stubborn people I've ever known and did exactly what she said she'd do. 34. My grandma did something similar. They had sold their house, that they had built and raised kids in, to downsize and move into an apartment, and I think she never got over that. She kept having scares and ending up in the hospital, and finally the last time the docs were just like, "She's fine, we have to discharge her." And she was like, "I am not going back to that apartment," and died right before her discharge. Everyone was flabbergasted and in mourning, and OFC I was sad too, but all I could think was, good for her. I mean, obviously I would prefer if I still had my grandma around, but she went out on her own terms and made a point while doing it. 35. My mom came home to me in hospice and one day said, "I'm done. I'm tired of fighting. I'm going to sleep." She never woke up after that. I'm happy for her because she fought so hard, and I know she was tired. Think of her a million times a day, and coming up on her death anniversary on the 2nd. 36. Same for me slightly. My mom was fighting metastatic liver cancer for almost 2 years, and the last 2 months of chemo killed her stomach. She couldn't keep food down and was in the hospital for almost a month. My sister and I took turns spending the night with her. On my night she was coughing up black, mostly tar substance, and I went out to the nurses to ask if they could give her something, and the nurse put her hand on my shoulder and said, "Honey, your mom is dying. There's nothing else we can do." No one had said that to us before, as her oncologist was still for fighting the cancer despite the fact the chime ruined her stomach. After that gut punch I gathered myself and went back to my mom, and the nurse came in and we got her comfortable in the bed. My mom said to me after the nurse left, "I'm tired of fighting." I said, "Ma, do you know what you're saying?" She said, "Yes, this is no way to live. I want to go home." She asked me to make sure she could go home and not suffer anymore, and please let her go to sleep and just never wake up. We brought her hospice set up to her home and my sister and I stayed with her. The most wonderful hospice nurse honored my mother's wishes and made her comfortable. Everyone came to see her and say their goodbyes while she had the most lucid and peaceful last conscious day. We laughed and shared memories and photos. As the day drew into night, she became weaker and more sedated. We said we loved her and she said she loved us. To have her tell us she loved us as her last words gives me some peace. We told her it was okay and we'd be fine. She went to sleep and never regained consciousness. It was the most peaceful death and I am hopeful we honored my mother's wishes. She didn't suffer after leaving that hospital. 37. PEDS EQ HIV positive kid. Must be 3 years old. Got infection from mom. Bad shape. Bud was a delight to play with. He had a transformer toy. Routine rounds, we used to play with him. I broke a small part. Promised him to get a new one next day. He passed away at night. I am haunted by that promise. 38. He passed away believing that he would play with you again the next day, with a new toy. I think that's beautiful. 39. Thank you for having thoughts this pleasant and for sharing them with the internet. 40. Maybe donating a toy every year on his birthday or anniversary of his passing might ease your mind. 41. I don't work in a hospital, but when I was younger my family moved in with my grandmother to take care of her while she was dying from lung cancer. I used to sit with her in the den and read to her. One morning, she looked right at me and said, "Go get your father, I'm dying today." Then she did. 42. Family has a weird way of holding on until they're ready to let go sometimes. My father was deployed overseas and his dad wasn't doing well, but it was near the end of his deployment and he was allowed to leave about 2 weeks early. He flew back to Virginia from Kuwait and managed to see his dad before he died the next day. My grandmother was able to wait until receiving a phone call from her daughter, my aunt, in Baltimore saying goodbye before taking one more large breath and passing away right there. 43. I'll never forget the moment my grandpa passed. He had raised me as my father, so I was allowed to sit with my mother and him at the end, even though I was only 16. It was clear that, even though he wasn't conscious at this point, he was holding on fiercely. My mom finally leaned down and gently told him that he could go, that we would be okay. And then he took his last breath, just like that. 17 years later and I still miss him so much. But it feels good to talk about him. 44. My mother held on until my brother and I got home. It was supposed to be a random visit. The two of us were with her when she died. 45. I was visiting my grandpa and had to leave town and go back to medical school, and I told him I loved him and would see him later. He told me he loved me too, but no, I wouldn't. He was right. He died a week later of pneumonia. 46. I held the hand of my best friend who had metastasized breast cancer. When I kissed her cheek goodbye, she had tears in her eyes and wouldn't let go of my hand. I said, "I'll see you tomorrow, don't be sad." And while still clenching my hand, she said through her tears, "I love you, don't you ever forget it." She closed her eyes right then and there and passed away after her 9-year battle with cancer. 47. All these stories are really making me tear up. 48. It's not my fault, right? A patient, a very long time ago, about 2 to 3 minutes before he died from complications of AIDS, pneumonia. I told him it was absolutely not his fault. I still think about this at least once a week. 49. That's how my grandpa and his partner died. My mom talks about it a lot. I never got to meet him, but I think I would have gotten along with him. 50. As a gay man myself, it would have been the world to listen to his stories. As a native, losing him was losing a whole library of traditional knowledge that may never be found again, especially since he was a prominent figure in the tribe on queer and wink peoples and their roles in the tribe. I just hope I can accomplish something myself. 51. As an adult gay man, thank you so much for taking care of us back then. A big reason we're where we are now is because of angels on earth like you. 52. Don't tie that. I'm not going to make it. I was trying to check his manual BP cause automated was detecting nothing. He passed away minutes later. 53. Not words but just pure terror and not being able to talk from pain. I've been a caregiver for 1 month. On my second day without training I was left alone with 10 residents. One of them who was on hospice, and I knew nothing about any of them due to no training, fell off his bed. When he fell, his catheter ripped out of his penis. And from the blow he expelled his bowels and hit his head. The man was a ticking time bomb, but I knew nothing. He was basically dead when he hit the floor. He just hadn't realized it. I ran into the room and cleaned him and held him until EMT arrived. All he could do was cry and moan. He shook and looked around as if to say, "Why does my life end this way?" His eyes said it all. I comforted him in his last moments and held him like a mom would. EMTs took him away and then he drowned in his own fluids in the hospital. Rip R. I knew you for a few hours but you taught me so much about empathy, caregiving and actually caring. 54. I was completing my internship at an elderly home for individuals with dementia. One day, one of the residents experienced lower saturation, low oxygen, and had a fever. He wasn't feeling well, and given the ongoing pandemic, we decided to call an ambulance just to ensure his safety. When the ambulance arrived, they conducted a brief examination and determined that he needed to be taken to the hospital. We packed some of his clothes, and they placed him in the ambulance. Before leaving, he expressed gratitude, saying, "Thank you guys for your care. I don't think I will see you again. It has been enough for me." We were taken aback by the unexpected statement and didn't know how to respond. Unfortunately, he passed away 3 days later. It still amazes me how he had a premonition about his impending death. 55. I had this one patient when I started my first hospital job as an RN. It was in a rural hospital and I worked night shift, so generally quiet, although we would get slammed some nights too. This was one of the quiet nights and I had this patient that was an elderly guy, in his 80s or 90s. I actually don't remember what he was sick with, probably just failure to thrive. He was bone thin, like completely emaciated due to no appetite. The 3 things I remember about him was 1. He was an engineer in his working life and was downright fascinated by the IV catheter I had to use to put an IV in him. They are spring-loaded so that once the needle is inserted and in position, you press a button and the needle retracts, just leaving the plastic catheter. He asked me to show him the mechanism a few times. The second is at one point he said he was weak as a kitten. I never heard anyone say that before, but I just think about it and laugh. Seemed like an old-timey thing to say. Last thing he said was, "Ever seen a man die?" And I said no. He said, "Well, you're gonna see one tonight." I laughed at that too, even though it was very morbid. I assured him I wasn't going to see a man die that night, and I didn't. But I don't think he lasted more than a week after that. 56. When a relative of mine entered hospice, the hospice staff conducted a sort of patient's life history interview with the other family members. They told those family members that there are 3 types of people who tend to take a long time to pass: very young people, people with unresolved family issues, and engineers. They explained that engineers have solved problems all their lives and tend to see death as one more problem to solve. My relative fell into the middle category. 57. Me over here, a young engineer with unresolved family issues. Great.